So we're now in the 15th of October, 2020. Um, and yeah, Ireland is reversing pretty hard. Um, so is France. Some dissent in Germany. The, the situation arises where I think it's very healthy in all arguments and in all areas of doubt that you take the opposing view yourself and you argue it as strongly as you possibly can, for your own, just to be open to the fact that you could be wrong. And personally, I've been wrong many times, and on very big issues as well, that I can recall clearly when that happened, and I try to understand how it happens, why it happens, what I did wrong, what were the circumstances leading up to it. So I've done this with COVID repeatedly, because of course you should question something at any stage, but when the vast majority of people disagree with your perspective, and when those that agree are really unpleasant individuals that claim the right wing, and they seem to have a similar position because they genuinely don't care, um, rather than arriving at the position of the lockdown being really damaging mistake because it has been a misinterpretation of the severity, the data, and an utter focus on one um, viral disease to the detriment of all other healthcare. Um, anyway, I've kind of disagreed with myself already, haven't I? But I've tried taking this approach of agreeing with the majority and building out the idea and thinking to myself, okay, so it's a viral disease. It is certainly um, fast spreading. It kills people, according to statistics, in relatively large numbers. Every life is worth saving. An economy shouldn't come before a life. I don't want to get it. I don't want to be sick. I don't want to be lying in bed, having difficulty breathing. I certainly don't want to give it to my elderly parents. I don't want to be a part of that chain. It's not that much for me to wear a mask when I go out, is it really, when you consider the consequences? Um, and I've also, by the way, gone down the route of actually maybe I'm wrong. Maybe this is a serious challenge to our health systems, and to our health systems becoming overrun, and that the severity of what showed initially in New York, for example, doesn't lend itself to a traditional influenza-like virus. But you just can't continue. I can't continue to entertain those opinions when logic disagrees, and when I can look at something and I can say, okay, well, show me the numbers, and I can look at the numbers and it doesn't agree with that. Do you know? The big key thing, for as always in these videos that I highlight, is that people die, and this doesn't mean it's good news that they die. It really doesn't. But you must understand that if there was no COVID at all, 30,000 people roughly a year would die in Ireland. 160,000 people a day would die in the world. What we've never tracked a virus like this before, with this kind of high resolution. How an awful lot of people die is they come to the end of their lives, okay? And we see that as a natural aging process. But nobody actually dies of aging. It doesn't exist. You have to die of a disease, okay? I think a lot of people think you can die of aging or die of old age. Well, no, you die of a disease. Now, those diseases are related to old age and they build up and they accumulate, and your body becomes frailer and sicker, and you're in a very vulnerable position. And you may die from heart disease, you may die from cancer, you may die from, be it a stroke or a heart attack, or there can be a number of things that you'll die from relatively instantly. Excuse me. Um, but in many, many, many cases, what happens is an elderly person falls, for example, because they have brittle bones, because they have osteoporosis. They fall, they break a hip or something like that. They're then being treated. Of course, their immune system is even weaker. And in the ins and outs of that last couple of weeks of life, maybe they're in hospital, maybe they're not. Maybe they're in a nursing home. They pick up whatever infection is going around. It doesn't matter what. It could be the stomach, the vomiting bug. It could be the influenza. And it could be, in this year, COVID. And then they die with that. And that virus hastens their death to some extent. But realistically, when a 94-year-old person goes through what I've just described, we don't think that the flu killed them. Not really. The heart failure that they had for the last 30 years, the cancer, the underlying cancer that they had that maybe wasn't, the lung disease that they had, the brittle bones that they had, the almost non-existent immune system that they had, the 94 years that they had. That's what killed them. Okay? The influenza or the COVID was just the final straw that broke the camel's back. So how many of the deaths have occurred like that? Because we can't just say that, oh, well, that isn't what happened because of convenience. We have to look. And the way to look at that is to look at the age of people dying, the average age of people dying, and the studies that have been done. Okay? So that's the first thing anyway, is there has just been an overestimation, a really substantial overestimation of the number of people who have actually died. I don't know definitively, and I know you can have a young person who's immunocompromised and die from COVID and they could have lived another 30 or 40 years. But the reality is, if they're in that immunocompromised position, and of course you do everything to protect them, but they'd be in the exact same situation as the influenza. And I can see two arguments here. I can see someone turning around and saying, yeah, well, we should shut society down for influenza every year. Yeah, well, I mean, we do actually have some vaccines for influenzas, and we still don't really get a hold on it. It's a lot less than it used to be, but there's reasons that we don't shut down society, and it isn't really about individual freedom or not caring about your other. Look, what we're doing with shutting down society like this is we are causing immense problems, immense problems. So the people in the developing economies that, unfortunately, because of history and the inequality that we're bequeathed with, and we continue to kind of perpetuate, their existence, their living is based on supplying materials to the developed economies. The developed economies put the brakes on, and literally millions of people are at risk of starvation at the moment. Come into Ireland. Hospitals, doctor surgeries have almost shut in the last coming up in 7-8 months now, whatever it is. The numbers of people coming forward for referrals for things like cancer has plummeted. Hospitals still don't really do endoscopies and things like that. So will these people die tomorrow, the day after? No. But if they have been diagnosed at stage 1, their outcomes are much, 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 much better. And of course, we can do the statistics in this. This is a lot of people that will have progressed from stage 1 to stage 2, and so on. And in 3 or 4 years' time, or in 2 years' time, depending on the cancer type, or less, then these people will lose their lives. Similarly, with things like heart disease going undiagnosed, people not coming forward. So there is an enormous cost to this. There's also the fact, as I said in earlier videos, that when you have an economic recession, you have a fall in the economy. Yeah, and the economy is not, the whole economy isn't worth the life. I completely agree with that. But again, the way we have our system set up, the tax take from economic activity goes to paying for things like healthcare. So healthcare into the future, in coming years, is going to be really adversely affected by this, and people will go without treatments because of the shutdown, not because of the virus, because of the shutdown. So we know that the average age in Ireland of deaths is 84. The average age, of COVID deaths. The average age of deaths is 81. And we know that where they've studied in Italy, 99% of people were found with, and they say underlying conditions. Trust me, what that means is they're dying, okay? They have multi-morbidities, and there's a whole bunch of things lining up because of their age. Look at the age profile of the people that died there. People will return it and say, oh yeah, but I saw a 41-year-old. Again, yes, this can happen, but we know younger people, it can happen because of immune compromise. But we know younger people actually die in higher numbers from influenza. And COVID is a more serious virus than influenza. But while we would be right to lock down the world if something like Ebola was to spread, thankfully we seem to contain that. And there's a relationship, I think, between the viciousness of the virus, the immediacy of the effect, and the totality of the lockdown. I do think there is thankfully, a connection there. That sort of, so far anyway, unless we get something that can remain dormant, that is incredibly infectious and also very, very dangerous when it manifests itself, I don't think there'll be a global pandemic in the likes of what we assumed this was. But this certainly isn't it. It certainly isn't it. And the numbers just don't add up. And there's no point in saying, oh, I feel frightened, so I disagree with what you're saying. And because what you're doing there is you're causing an awful lot of harm on the other side. Huge amount of harm. And even if this were just a question of opinion and interpretation of numbers, which of course it isn't, but one massive problem is the country of Sweden. Now, unless the whole country is a figment of imagination, they ran an experiment. And go and look, don't just read something that you saw in the newspaper that supports the government and that generally thinks, Sweden is different because they're Swedes, or Sweden is different because it's, they live apart from each other, or Sweden is different because they had a lot of debts, or Sweden is... Go and look at it. The reality is Sweden has a slightly higher number of deaths per million people than we do, but lower than the UK, Italy, Spain, Belgium, all in Europe. Okay, Sweden did not close schools for people 16 and younger at any stage. At any stage, pubs and restaurants were open the whole time. They did a little bit of social distancing. They washed their hands. They were sensible. Now you look around Stockholm and all the bars, all the restaurants, everything else is open. Now, look, this should be wonderful news, because if what we thought was correct, Jesus, Sweden would have an unbelievable level of deaths. And if we think, well, yeah, but there's a second wave coming and there's the thing. Okay, Sweden has over 10 million people. We have 5, all right? In the last 2 weeks and in the 2 weeks before that, just go and look at the numbers in Sweden. Please, I'm begging you, because this should be celebrated. In Sweden, in Ireland and Sweden, I believe in the last 2 weeks, in the latest WHO report, there were 11 people dead in Ireland, which is nothing when you consider 100 people are going to die every day. 11 people dead with COVID related whatever. And in Sweden, it was 5 people. Now, you cannot make Sweden disappear because it doesn't feel right, and you're sort of confident and comfortable in your own panic. At some point, we have to escape that and get to logic and get out of this people looking at each other with a cloth mask and saying, well, why aren't you wearing a cloth mask? Just as an example of where this has gone. Look, there aren't that many surveys. There are, maybe 8 credible surveys into the efficacy of masks. And I think there's some general trend towards surgical masks being in some way beneficial. Cloth masks, not in the slightest. Okay, which is what most people who are in judgment of others are walking into the shops and the coffee shops wearing cloth masks. The things don't do any good. In fact, they will harm you, the wearer. And by the way, it's incredibly frustrating not to be able to get any public representative to even entertain these ideas, because you do feel like you're screaming into the wilderness. And if someone can turn around and say, look at that Barrington Great Declaration or whatever it was, and stand there and say, okay, here are the reasons why these scientists are wrong, and here's the reason why Sweden, though it seems right, is wrong. I'd be fine with that. If someone could convince me using numbers and logic, I'm all on board. Sign me up. I'll have a bandana across my face. But the lack of a willingness to engage and to question yourself is incredibly damaging. And this isn't just a matter of who's right and who's wrong and this is costing a lot of lives and doing really terrible damage. It's also damaging, I think, the science and the medical professions and their credibility. And I don't fancy people, the amount of idiots that don't vaccinate children already, I wouldn't think that number is going to go down when they add in, oh, they didn't know what they were doing. So I beg Irish politicians and other, influencers to at least engage with the possibility that they might be somewhat wrong here, and to open up to other sides of arguments and to be able to have a debate. And now preferably, because it seems like almost certain that Ireland is going to follow a route over the winter, and it's immensely damaging and almost certainly irrelevant. That's not good, and it needs to be discussed. Please bring it out and have that discussion. Do it whatever way you want. I don't really care. Just do it.